Today, I'd like to talk to you about neuromuscular retraining for chronic low back pain. I had 3 new cases last week, and all 3 are about 50% better this week. So the treatment works, provided it's the right treatment for you. One of them also has a hip issue, so perhaps both issues, for him have to resolve simultaneously in order for him to become pain-free. Typically, in these cases of chronic low back pain, the pain is in the paraspinal muscles, the paraspinals, and the QLs, the quadratus lumborum muscles. Now, sure, I could put needles in them that helps them relax, gets rid of some of the pain. More often, I pin and stretch them. That's how I start. I take the muscle, and QL pulls you this way. So what you do is you find it on the corner, you push, pin, stretch, pin, stretch. Paraspinals are more straight, they're closer to the spine. Pin, stretch, pin, stretch. And of course, you find the tightest, most painful points. I pin and stretch them out, and that's a good way to start the session. And I may even bring the partner in and ask them, is your husband and wife around? Can they come into the session? And I'll show them how to help them with that pin and stretch, because the muscles will tighten up again. Hours later, the next day, it'll happen again and again. These people, they don't get relief from going for a massage. Their pain comes right back the next day. Their muscles tighten up again. So hot packs, hot shower, needling, they only provide temporary relief. We want a long-term solution. But getting rid of the tightness and pain will help us get there. If there's less pain and tightness, then the exercises can be more effective. And as the exercises, the benefits from them start to kick in, it'll be longer and longer before the muscles start to tighten up and they won't get as painful. These cases often start with an old injury, many, many years ago, 10 years ago, 20 years ago. And the patient often assumes it's that injury still causing the pain. I slipped and fell, doctor said I had a degenerated disc. Must still be that degenerated disc, still be that disc herniation, must still be that strain. Whatever it is, they think it's coming back again and again and again. Very rarely is the old injury actually causing them pain. It's those painful muscles. Now, why are they painful? Now, in addition to those QLs being chronically tight, the multifidus muscles tend to be atrophied, wasted away. So you have some muscles that are too big, bulky, tight, and then you have other muscles that are wasting away because your body's obviously not using them. Now, the multifidus muscles are the segment-to-segment control muscles of the spine. After the first injury, you can imagine that someone's going to move around very stiffly. They may even have a round of bed rest. It doesn't take long for your brain to forget about the fine motor control muscles of your spine. They find in functional MRI scans of the brain that there's less of the brain devoted to moving the back in those with chronic back pain. We have to reverse this change. We have to get the brain using those muscles again. Without fine motor control, your back only has those QLs, and it ratchets them both down tight on both sides. And they need to stay tight because they're the only muscles that your body knows how to use. So I relax them, and then the body's like, whoa, what are you doing? I'm using those. Tightens them right back up. And they're going to get achy and painful from being used hour after hour, day after day. A test of the low back is I ask them to do a slow motion into the lumbar spine. The lumbar spine being the low back region. In those with this type of chronic back issue, it'll give them a sense of anxiety. They're scared. They may, I'm going to throw out my back again. The motion itself is jittery. And sometimes they find it impossible. Their body will just not let them move their back. So for example, one of the exercises I like to start with is pelvic tilts. And this often leads into neutral pelvis, which is part of a good posture, which I try to have all my patients have a good sitting posture that's easy to maintain. And part of that is having your pelvis in the correct position where it's at the balance point and you can let your muscles go and you still have a nice curved lordosis to the low back. Well, that's the posture work. But before we get there, we have to make sure our pelvis can actually move back and forth. So I'll have them grab their pelvis and I'll say, okay, I want you to slowly move the pelvis forward and back. And sometimes I see this. I was like, that's not moving your pelvis. Move your pelvis forward and back. And some of them just can't do it. They're like, I don't know why it's not moving. Their brain is basically saying, no, don't do that. I'm not good at that. I don't want you to do that. For others, they're able to do it, and that's it's very ratcheting and jittery motions. Treatment is to slowly relearn the motion. I start small, or have them start small, sometimes moving the back only a centimeter. And that could be the entire exercise for the day or the session. The next day, maybe they get 2 centimeters, then 3 centimeters, 4 centimeters, day after day, they get better and better, get smoother and smoother. As they master one movement, I have them challenge themselves and try to find other movements that make the back jittery, give them that sense of anxiety, and they practice that movement. You go in small parts and more every day until they can move their back however way they want, and it's nice and smooth, and it feels confident and feels strong. Eventually, the person returns to normal and just gets, normal, the occasional backache from, a long drive or something. Everyone gets a little bit of backaches, but normal level backaches, not the extreme back pain, not the extreme backaches that they've been getting for 10 years, 20 years. We can finally get them out of that. Now, some of my favorite exercises I'll go through here. The first one I've already mentioned is pelvic tilts, because once they master that, I can go straight into posture exercises. And they might start with, oh, it jumped. Okay, I'll go back. And they might start very, very small, very subtle. The next one is bending forward. And that one they're often very scared of, because that they often associate with their first injury, because their first injury was lifting something. So they're scared to do it. And so I ask them to do it, and their low back just won't bend. And when you're lifting a heavy weight, using your knees and such, maybe you don't want all that motion into your lumbar spine, but you should be able to use the low back for moving, right? So I might have them lean forward, and this is what they do, right? And their low back doesn't move at all. And then I'll say, okay, well, try to get some motion. Okay, well, coming up is also jerking. And just start small, feeling their back and trying to feel for that little bit of curvature. And sometimes even within a single session, they're able to go further nice and smoothly. But there seems to be a limit to how far they can get in a day. Learning takes time, day after day after day. You're not going to master a musical instrument in a day. You can't do it. You don't have that muscle memory. You have to build day after day, that coordination day after day. So this isn't something that you snap your fingers and it's going to get better in a session. Although some people do feel the difference within even just a single session of this. Now, they can add twists as they're going down, once they master going down just straight up and down. The next one I really like is a slow twist with a little bit of resistance. So for the slow twist, I like, you could be cables, could be one of these TheraBands, some sort of stretchy elastic band. And, they can pull, but typically they'll turn their whole body at first. It's like, no, we want the motion to the low back. So try to square up and try to get that twist into the low back. Our bodies are machines. We like achieving goals. I want to go from here to here, slow and steady, and we're working against some resistance. This is a feel-good exercise. This can feel really good. When this is nice and smooth, they can make it a little different. They can back and do it. They can go downwards. And of course, on both sides, they could even add some resistance, maybe even sideways, to bending forward. So they're bending forward, but there's another force, pulling them a little off balance. So it's working the back muscles in a slightly different way. So this is a great way of challenging those back muscles, those control muscles, in a different way. An exercise ball is an excellent tool for these types of exercises because you feel very supported and you can get those motions into the low back nice and smooth. Again, they're going to be jittery, and also they'll tend to do this. That's not moving the low back. So, and it'll be a struggle for them. Again, jittery, and they can practice that, being nice and supported by the ball. And they can practice, so side to sides, they can practice sort of forward and back, so sticking your butt out and sort of starting to curve down. Diagonals, sort of a hip thrust towards one knee, and then sticking your butt out at the opposite direction. Of course, trying to do slow circles, small and large circles. And you can combine this with other exercises, more endurance and strength. You can roll all the way down. You could push up, work the glutes, and push back up. And of course, the exercise ball is my favorite way of doing more standard exercises. Like, I love the exercise ball because, of course, you can do crunches of all sorts, and you can do side crunches for the obliques. And it's just nice and comfy. If you've ever done crunches on a ball, you'll never do crunches on the floor again if you can help it. But the purpose is, in this video anyway, is those control exercises. Now, this is all in addition to those standard core rehab exercises. And those standard core rehab exercises can also help. But typically these chronic pain patients, they've done standard rehab before. And just the standard rehab didn't help them. So some standard rehab exercises that may help, dead bug, quadruped, glute bridge, the core stuff I just mentioned, working the core, working the glutes. Those exercises can supplement, but for the chronic pain, you have to focus on that fine motor control. You can't take out those multifidi and do like a bicep curl. I can really isolate the biceps. You can't isolate them. You can only work the brain to require that fine motor control to get them to start working. And so that's been my trick, if you will, to help these people with chronic low back pain. I hope you found this helpful. Wish you all the best. Cheers.